Hello everyone. Today I will discuss with you about two common gastric system disorders which are Crohn's disease and ulcerative colitis. Crohn's disease and ulcerative colitis are known as inflammatory bowel disease. The short term is IBD. Both of these conditions affect the bowel, but in slightly different ways. Crohn's disease actually causes inflammation of your um, whole digestive tract from the mouth to the anus. So any part of your digestive tract could be affected by Crohn's disease. However, ulcerative colitis only affects your large bowel, which include colon and rectum. And inflammation only happens to the inner lining of the large bowel. So the difference is that ulcerative colitis affect the large bowel, while Crohn's disease actually affect the whole gastric systems. More than 75,000 Australians have one of these conditions, so it is really common among general population. They usually begin in the people aged between 15 and 30 years, but can also start at any age. Crohn's disease actually start to become more common among children under 9 years of age. Treatments are available, but we should know that normally food, diet, or allergies do not cause inflammatory bowel disease. So controlling diet is not very effective in treating IBD. Normally, people with IBD could still lead normal lives most of the time, but if it gets really serious, now we should seek treatments and get diagnosed. Every person actually responds differently to IBD, and the severity of symptoms also vary from person to person. Some people only have mild symptoms, while others have moderate to severe symptoms. It all depends on the nature of the person. So the normal symptoms include abdominal pain, weight loss, diarrhea, blood and mucus in the stool, fatigue, constipation, malnutrition, nausea and vomiting, and even impaired growth in children. Like we just mentioned before, the causes of the disease are unknown. However, scientists actually believe that an important cause could be dysfunction of the body's immune system. So if the immune system actually doesn't work properly, it could lead to this condition. Also, infection by bacteria or virus could be another reason. Scientists actually do not think that diet and stress cause IBD. So adjusting diet and managing stress could not effectively cure this condition. Now, if you suspect you have Crohn's disease or ulcerative colitis, the best way is to get a blood test and stool examination done. So doctor will collect some like stool sample and then send to the pathology to test whether there is any infection. If doctor think it's necessary, they will do a colonoscopy or gastroscopy. So gastroscopy is like sending a tube into your stomach to see the problem inside the stomach. While colonoscopy is like sending a tube containing a camera on the tip and into your bowel to see the internal structure of the bowel and see any problem inside the bowel. So colonoscopy and the gastroscopy are the procedures normally conducted by doctor to inspect the internal bowel. Now, the treatments include using medications to reduce the chances of flare-ups. Medications like steroids, corticosteroids, can be used to reduce inflammation symptoms. Also, some medications can be used to reduce the activity of the immune system. So it's because we know that diet and food allergies do not cause IBD. So long-term special diets could not effectively treat inflammatory bowel disorder. However, you still need to keep healthy diet because healthy diet can help to manage some symptoms, can make you feel a bit more comfortable, even though it cannot fully cure the condition. So let's have a look how the digestive system actually digests the food. Your mouth and stomach breaks down food by mechanical and chemical means. So the food actually passes through your mouth into the esophagus and then into your stomach. And then from the stomach, it will then further pass into small intestine. Okay, and from small intestine, the nutrients will then pass into the bloodstream, and then the food needs to be properly break down and then turn into nutrients, and then the nutrients can only be absorbed into the bloodstream to be supplied to rest of the body. Now the rest of the food will be pushed into the large bowel, and water will be reabsorbed, and then the waste products will be temporarily stored in the colon, and then it will be eliminated from the anus. So that's how the body actually processes food and eliminate the waste. Now, some organs like pancreas and gallbladder actually produce digestive enzymes, and these enzymes can help to break down the food into smaller components, smaller pieces. So remember that the food can only be used by the body when it is properly broken down and turned into nutrients, and the nutrients needs to be absorbed into the bloodstream and then delivered to all parts of the body. So if there is an inflammation of your digestive system, if the food could not be properly broken down, and the nutrients cannot be properly absorbed, then people will have all these like kind of symptoms. So I hope now this small lecture could help you understand what is like inflammatory bowel disease and what are the two conditions, what are the common causes of these conditions.